In this set of reflections, I wish to focus on the core of our layered public health approach, the core of the approach of every institution at this time: testing, tracing, and quarantine and isolation. I offer these reflections based on our experiences of these opening days of this fall semester. Each Monday, we provide an update on the positive cases of COVID-19 in our community. This past week, in the period between September 7th and September 14th, we experienced 13 positive cases of COVID-19 on or near campus. 3 of these cases are of members of our community who are coming to campus for work, either for research in our laboratories or in support of those who are in residence. We currently have approximately 470 undergraduates living on campus. 8 of our positive cases were undergraduates living in our residence halls. I'd like to take you through how our protocols work. How did we identify positive cases? Once someone tests positive for the presence of the virus, what are the immediate steps we take to care for that member of our community and for those with whom the person may have been in contact? The first step in our process is testing. As I have shared with you in prior reflections, we have put into place a significant framework for testing. With our partner, One Medical, we are testing twice a week every member of our community in residence and those coming to campus 2 or more days a week. The key element, we are testing asymptomatically, people without symptoms, but who could be carrying the virus. The best understanding we have at this time is that 40% of people who are infected are asymptomatic or pre-symptomatic individuals, those who do not have the symptoms of COVID-19. The only way to identify these asymptomatic or pre-symptomatic individuals who can spread the virus unknowingly is through widespread asymptomatic testing. Why twice a week? Studies have shown that COVID-19 tests can produce false negatives. According to the CDC, a negative test result indicates one of 2 things: that you did not have COVID-19 at the time of testing, or if you subsequently test positive or develop symptoms, that your sample may have been collected too early in your infection for it to be detected by the test. Testing twice per week those regularly on campus or living on campus is a crucial layer of our public health framework. If an individual tests positive for the virus, we will notify our public health authorities, DC Health, the Maryland Department of Public Health, and the Virginia Department of Health. They will begin appropriate steps for contact tracing, identifying those who might have had close contact with a person who tested positive. Close contact is understood as having been within 6 feet of a COVID-positive individual for at least 15 minutes. It is important to remember that the public health department, where each person who tests positive lives, either in DC, Maryland, or Virginia, will determine who needs to be contacted as a, quote, close contact, close quote, based on its investigation of each case. This helps to protect privacy and medical confidentiality. Georgetown has created a new team of what we call care navigators to provide information and support for anyone in our community who tests positive. They also play a role in contact tracing efforts on campus, taking very seriously our commitment to confidentiality and privacy. Isolation is required for anyone who tests positive for the presence of the virus. Quarantine is required for anyone identified as an immediate, close, and proximate contact with someone who is tested positive. A 14-day self-quarantine may also be required after travel to specific states designated as hotspots or outside the United States. What happens when someone tests positive and goes into isolation? Well, once we learn that a member of our community has tested positive, they will be quickly contacted by a care navigator who will help transition them into isolation. Care navigators provide guidance through each aspect of the isolation process, providing options and information on health services, mental health resources, and regularly check in to see what additional assistance might be required. For undergraduates living on campus, we place them in a special designated place on campus and provide immediate wraparound service, including meals and snacks, mail delivery, and laundry. If there are no symptoms, isolation lasts 10 days. If a person experiences symptoms, they must see certain improvements after that 10-day period and have to be fever-free for 24 hours before the period of isolation can conclude. Working with DC Health and the individual who tests positive, we identify those with whom the person may have been in immediate, close, and proximate contact. We will test these individuals immediately, and we will also place them into quarantine following the DC Health guidelines. If someone is in quarantine, they have not tested positive for the virus, but they have been in immediate, close, and proximate contact with someone with the virus. One is expected to remain in quarantine for 14 days, regardless of their test results during this period. While in quarantine, there are certain limited activities permitted outside a person's residence. Students who are on campus in quarantining also receive meal delivery services. Now I'd like to turn to our Director of Public Health, Dr. Rinit Mishori, to provide some additional context on our efforts this past week and the experience of someone who was placed in isolation and for one placed in quarantine.
The idea of a layered approach is to have multiple interventions in place. So, and not to focus only on one issue. For example, not to just focus on hand washing or just mask wearing or just social distancing, but to combine all of these. So ideally, people would adhere to all of these measures, which include very regular testing of asymptomatic people and practicing all the public health measures, as I mentioned, mask wearing, social distancing, hand sanitizing, and other such very common public health recommendations. When somebody's identified as with a positive test, we have a team of about 20 care navigators who immediately get in touch with them and inquire about their whereabouts and make sure that they're moved into isolation. If they live on campus, they're moved to an isolation unit on campus at Henley. But if they work on campus but live elsewhere, live in the community, or have a residence off campus, they are asked to isolate at home. When students are isolated, on campus. They actually have to move to a different location for 10 days, and the care navigators arrange for food to be delivered, for laundry, for cleaning, and also we connect them with health services, from physical health through student health, through mental health services and other support resources. It takes a lot of effort to actually implement and operationalize any public health intervention, but particularly one that involves so many moving parts. So it involves making sure people follow public health measures, making sure people test, and then getting all of these tested interpreted, getting these tested reported, calling the people who are isolated, moving them to special locations, calling all the people who need to be quarantined. It takes a lot of people, a lot of thinking, and a lot of patience. There's a core team at Georgetown who is tasked with these operations, the Georgetown Public Health Unit. We have about 20 care navigators who do a lot of this work, a lot of the legwork of calling people, of notifying them, of trying to determine who their close contacts are, of notifying the close contacts. We also have to work very closely with the DC Department of Health, which takes it has its own challenges of timely reporting and coordination of our response with their requirements. So it's a very complex operation. And so far, I think it's worked very well. The reason we're finding cases is because we're testing. I think at Georgetown, we have the most intensive testing protocol of all local universities. So, if you hear that more people at Georgetown test positive, it's true because we test more people. We test more asymptomatic people because we need to find them as early as possible so we can stop the transmission as quickly as we can, because so many people live on campus and it's what's called a congregate environment. When people live together, the risk of transmission is greater.
Mark Barbieri leads our Office of Emergency Management. He works closely to coordinate with our city and is responsible for our Care Navigator team. Mark shared some perspectives on the framework we have in place for testing, tracing, and isolation and quarantine.
So I think here at Georgetown this fall, we've taken a very multi-layered approach to ensuring the health and safety of our community. And really, there's a number of aspects to that are critical. One is obviously education and ensuring that people are aware of the risks of COVID and how to protect themselves and protect others through their actions. The other is our testing plan. We are doing extensive testing of everyone on our campus and in our community to ensure that we detect early any potential cases of COVID in our community and can respond accordingly. I think the important thing to reinforce is that, first and foremost, we're doing all of this to ensure everybody's safety. And testing is really about knowing your status, but also about reducing the risk to the people around you. And it's not just the people around you here at Georgetown. It's the people around you at home. It's the people around you in the community. It's the people around you every day, every night. And so, everything that we do is about providing that level of security, if you will, not just within our community, but also outside of our community. When you get a call from us, the Georgetown Public Health Team, the Care Navigators, we're here to work with you. We're here to help you. We're here to get information. That information, that conversation is confidential. None of this is about, taking any type of negative action or any retribution towards any individual. This is really all about keeping people safe. Rest assured that our folks on the Care Navigators team are professionals who understand their role and understand the importance of keeping information about students, faculty, and staff confidential, and the importance of using that information for one purpose and one purpose only, to prevent the spread of coronavirus.
To our entire team working to support our public health framework, thank you. We are deeply committed to the health and safety of our community, and over these past few weeks and months, your efforts have been extraordinary. Thank you. I will see you all again next week. For Every Hoya, everywhere.